Hi, this is Josh. I'm a pharmacist with pharmacisttips.com, and today I'm going to tell you a little bit about Meloxicam, the 15 milligram and 7.5 milligram dosage, as well as the side effects of this medication. First off, Meloxicam is what's known as an NSAID, or non-steroidal anti-inflammatory drug. It's used to treat pain and inflammation, and it's specifically indicated for arthritis, although your prescriber may use it for any other pain and inflammation. In the US, it's sold under the brand name of Mobic. Now, compared to other NSAIDs, it does have a slightly lower risk of the stomach or intestinal bleeding associated with these medications, and its effect on the heart and cardiovascular system is considered moderate versus other anti-inflammatory drugs. So what's the dosage? Usually you're started on the 7.5 milligram one time per day. Sometimes that will be increased to twice a day, or just for ease of dosing, it's changed to the 15 milligrams and then given once a day. 15 milligrams is the maximum dose on meloxicam. Just be sure you talk to your healthcare provider before increasing the dose. Make sure that they're on board with the current dose that you're using. Side effects as a whole, we see meloxicam tolerated really well by most people. Common side effects include dizziness, headache, uh, upset stomach, diarrhea, nausea, mild rash, fluid retention. Fluid retention can happen with any of the NSAIDs, and we want to be mindful of that. If you start retaining some fluid, be sure to let your doctor know because that can increase the blood pressure and cause other problems. Flatulence can occur. Some of the rarer side effects include an increase in blood pressure. With all the NSAIDs, there's an increased risk of heart attack, stroke, heart pain. Rarely we can see some sensitivity to light with meloxicam, blood clotting issues, things that would show up on lab results. Sometimes it can cause liver function problems, and rarely a serious rash that would require a visit to the doctor or emergency room. Now, with all these NSAIDs, again, I'll just go over that risk. It can increase the risk of heart attack and stroke. It can increase the risk of stomach or intestinal bleeding. Also, they can affect kidney function and lead to kidney injury or damage, especially if your kidneys are already functioning lower than normal. So those are all things your provider would want to monitor if you're going to be using. I do thank you for watching. I hope that you'll subscribe to my channel if you found this information useful. Always, always, always talk to your healthcare provider if you feel like you're having side effects or other issues with your medications. And if you have any questions, something you'd like me to explain in detail, stop by pharmacisttips.com/ask.